Today we're going to be discussing Juvederm Volift. Hi guys, welcome back to the channel. I'm going to keep rolling with this Juvederm vibe that we've got right now. I thought I might as well just finish off the Vycross range. So we've covered pretty much everything except for the Volift now. And that completes the whole of the Vycross range. As I'm sure you remember from previous videos, they've got that hyaluronic range, which is the legacy kind of product, and then they have their Vycross, which is the new range. So this product is also available in the US. It comes under the name of Voluma over there, and interestingly this one also comes in a 0.55 syringe as well under the name of Juvéderm Retouch. So they're the same thing, it's just it comes in a 0.5 ml. So if you're getting 0.5 ml of Juvéderm, you're either getting the Retouch or Smile. Retouch is basically Volift repackaged, and Smile is Juvéderm Ultra 3 but repackaged as a smaller syringe. Volift is 17.5 milligrams per ml of hyaluronic acid, so it sits between the Volbella and the Voluma, and it's good for lips. I also use it a lot on people who are slimmer in the face, but that needs to be revolumized. So sometimes, you know, if you have a very, very slim patient, tiny, with not much fat on their face, and you need to add more volume into the face to make the face look a little bit more plump and a bit more juicy, if you use the Voluma, the chances are you're going to see it through the skin. If you use the Volbella, it won't do anything. So the Volift is really good at occupying that middle space ground. You can use it in the temple area. You can use it in the nasolabial fold if somebody doesn't have a particularly heavy nasolabial fold. I quite like it at the base of the nose. You can use it in the nose itself. One of the most common areas actually that I use it in is the anterior cheek. So when you're doing this area, as I'm sure you're aware from the previous videos, you want to be putting that underneath the muscle here. But it's soft enough to be used in that area. You can, at a push, even use it in the jawline if somebody's very, very slim and you don't want to be able to see, you know, when you first have an injection done and there's like a slight amount of edema there. So in some patients who just want the tiniest change, I will use Volift even in the jawline. For me, anyway, it's the third most commonly used Juvéderm. So I probably use Voluma the most, then Volux, then the Volift. I think so. And I use it mainly for lip augmentation. So depending on the area that you're injecting, I estimate that you'd probably get about 9 to 12 months from the Volift, but of course it depends on the person's metabolism, the site that you're injecting, how many times they've had injections before, etc, etc. I'd say that Volift would be good for you if you are having it in the lip and you want something that's a bit more full than the Volbella, or if you're very slim and you need a bit of structural work doing, or if maybe you're a bit younger and you're doing something like a nasolabial fold, then that's a good product for you. You could also use it maybe in a man in the forehead if the Volbella isn't going to quite cut it there. Eyebrows are another area that you can use it for, so augmenting the bone just here. And that's about it really. I'd say that it is versatile, but it really depends on how much fat you have on your face. Okay guys, so that's it for this week. I hope you enjoyed the video. If you have any questions or comments, you've tried the Volift before and you want to say something about it to the world, then let us know in the comment section below. In the meantime, don't forget to like the video and subscribe to the channel if you indeed did like it, and I will see you here again next week. See you later.